So we're going to take the questions at the end. I got a lot of material to cover. So my talk tonight is Longevity is Light, illuminating the pathway to anti-aging and pain-free living, okay? So let's imagine we're not at the Hyatt Hotel. We are on a spaceship. In fact, we are on the USS Enterprise of Star Trek. If you watch the movie Star Trek, they don't use medications. They don't do surgery. They don't inject cortisone. They heal through energy, light, magnetic waves. And that's what we're going to learn tonight, okay? Just a little background. I support Dr. Oz's Health Corps Foundation, and we want to teach teenagers and kids how to get off of dangerous addictions like the iPhone, video games, fentanyl, drugs, and alcohol. Teach them healthy, functional living and nutrition, okay? I am the former wellness director of the NFL Alumni San Diego. We had an event during the pandemic. Jim Stroll is going to speak, but pandemic shut that down, all right? And I volunteer for the UDT Navy SEAL Foundation to give back to our heroes, fallen and active duty and veterans, all right? So, we're on a spaceship, and that being said, we have an announcement from your captain, so let's watch.
Good to have you here. I'm very concerned about health care. The real issue is how do we keep Americans healthy? And I understand that is one of your goals. So tell me, what are you doing to help us stay healthy? Any new procedures and developments that help people to live more productive lives and in so doing, move America forward?
Well, Mr. Shatner, the non-invasive, non-intrusive medical devices once seen in Star Trek have now become a reality. We have developed new techniques and procedures using LED and infrared light technology, class 4 lasers, and pulsed electromagnetic field waves that are having a dramatic impact on those suffering from chronic pain. For the first time in a long time, these people are actually able to go out in the world and enjoy life again, pain-free. And that, Mr. Shatner, is how we are helping to move America forward.
So as I mentioned, who's seen this show Star Trek or the movie? And like I said, they don't treat with drugs, cortisone and surgery. You would lay on a laser bed and it would cure you like the movie Elysium, right? However, they might have injected stem cells like Dr. Bones McCoy. In fact, William Shatner did have an injection of stem cells from the laboratory that we use for our anti-aging effect, okay? Even Thomas Edison said, the doctor of the future will prescribe no medicine, but will interest his patients in the care of the human frame, diet, and the cause of prevention of disease. So we feel we are raising up the doctors of the future. So what do we do at LaserMed? Okay. The logo, the red, is like a crucifix, a cross, meaning compassionate healthcare like the Red Cross. And it also happens to be the cross of Christ, the greatest healer of all. The blue circles are the God cells, the cells that God made that heal the body. So we use bursts of laser light to activate the stem cells to repair your body. Life begins at conception. I know there's a lot of arguments. Pro-life, when is a person a sentient being? I'm going to prove it happens at conception because there was a study at Northwestern University. There's a phenomenon that happens when the sperm hits the ovum egg. There's a spark of light. They cannot explain what this phenomenon is. I think it's divine. Let's watch the study. So if light is necessary to spur the life process, when the sperm meets the egg, wouldn't it make sense you would need light to activate your body's endogenous stem cells to grow, divide for an anti-aging effect? All right? If you look at the book of Genesis, chapter 1, verse 3, it said, God created light and saw the light was good. And if you're an evolutionist, without respect, even Einstein said the sun was created in one instant. It's called the Big Bang Theory. If you look at the largest living thing on Earth, it's called the sequoia tree, particularly the General Sherman tree. Who's seen it in the sequoias? The tree is 3,000 years old. Now, how come the tree did not fall down because its trunk got weak after a few hundred years? What nutrient did that 3,000-year-old tree get every day? Light. It's called photosynthesis. And what nutrient does your body need so your bones don't get weak and collapse? Light. When the sun's UVB rays hit the skin, there's a photochemical reaction, and vitamin D3 is created, which is 1,2,5-dihydroxycholecalciferol. By the way, if you're on a statin, you cannot make vitamin D3. The cholecalciferol is the cholesterol component of vitamin D3. When you're on a statin, it shuts down your body's production of cholesterol. So you need to lower your LDLs by more natural methods, okay? When light, certain frequency of light enters your eyes in the morning, it stimulates your suprachiasmatic nucleus, which is basically your circadian rhythm, and that's your biological clock. When certain frequency of light enters your eyes, some of the light activates your pineal gland or pineal gland to release melatonin, and that helps you what? Sleep. Who has insomnia or sleeping problems? You need more light in your eyes, preferably at the break of dawn when it's orange, about 20 minutes a day. You don't have to look into the sun, just be outside, okay? By the way, the pineal gland does release growth hormone, so you could possibly release the growth hormone releasing peptides with certain frequencies of light, all right? We can actually program the 4 brain waves through different flickering light frequencies to reprogram the 4 brain waves, alpha, beta, delta, and theta. And we could monitor that through neurofeedback training. So if you have diseases like a slow functioning brain caused by Alzheimer's, Parkinson's, we could actually ramp up the brain waves, maybe perhaps stimulate the substantia nigra pars impacta to produce dopamine. The main light modalities we use is the handheld laser. That's a class 4 250 watt super pulse laser from Italy. It's the world's most powerful laser. It penetrates up to 7 centimeters for joint, skin, and nerve regeneration. We also use light emitting diodes, red light, with multiple wavelengths, 630, 655, 660 for hair growth, 630 anti-inflammation, 980 pain reduction, and 1064 for regeneration of tissue and activation of your endogenous stem cells. Here's how the class 4 laser works. Let's see the video. Through what's called photobiomodulation, which charges your stem cells battery called the cytochrome C process complex in your mitochondria, more nitric oxide production, and stem cell proliferation.
Laser therapy uses a process called photobiomodulation to change the condition of damaged tissue by stimulating cellular metabolism, thereby accelerating the healing process. A large convex treatment head can be used to compress superficial tissues, displacing excess fluid and enhancing laser penetration to deep structures. As light pours into the tissue, photons will be scattered, reflected, and absorbed. Lasers operating in the near-infrared spectrum from 650 to 1300 nanometers can penetrate to deep tissue structures. Light that penetrates into the tissue can be absorbed by melanin, hemoglobin, oxyhemoglobin, and water. Energy from these absorption events will be dissipated as heat, generating a soothing warmth in the tissue. The primary target for photobiomodulation is the cytochrome C complex, which is found in the inner membrane of the mitochondria. Cytochrome C is a vital component of the electron transport chain that drives cellular metabolism. As light is absorbed, cytochrome C is stimulated, leading to increased production of ATP, the molecule that facilitates energy transfer within the cell.
So the bottom line is, as you get older, your endogenous stem cell count goes down. Well, the health of the stem cell depends on the vibrancy, the potency of the mitochondria. So we can, in effect, charge the mitochondria with the negative electrons with the photobiomodulation. We can also stimulate your body's endogenous stem cells with a special device called the light stem. What we do, we take 100 cc's of blood from your arm, we spin it twice like PRP. We will put the syringe into the device, and it will photobiomodulate your blood, which activates these dormant, very small embryonic-like stem cells. These are remnants of stem cells when you were a fetus in your mother's womb. They actually circulate in your peripheral blood and bone marrow blood, but they're in a quiescent state. They're dormant. So with certain frequencies of light, we're doing research to wake up these, your own embryonic stem cells, which are more potent, they're more primitive, which means they're totipotent. They could differentiate into every tissue without causing teratomas or cancer, because it's your very own. Okay, here's how the machine works.
Very small embryonic-like stem cell pulse generator. And we're going to white label the laser membrane here. We put the 10 or 20 cc's of PRP or the Wharton's jelly or exosomes to activate those cells. So this is laser stimulated stem cell therapy.
So we'll take the laser-activated blood. If you have a systemic disorder, autoimmune, it could even be a metabolic disorder like thyroid, type 2 diabetes. We can IV your own blood, and then we use another laser to signal those cells to go to the body part we want, such as if you want increased ejection fraction, I'll show you that study. These are all the human cell tissue products available on the market. I just talked about PRP. The problem is pure PRP has a lot of growth factors and platelets. It's great for wound healing. It does have a short-term regenerative effect. It doesn't last because the V cells are in dormant state. You can heat your PRP called regenikine. That's what Kobe Bryant had in Germany to release more growth factors. You can freeze the PRP and put it in a hypoxic state, which releases its growth factors. But we find the laser stimulated blood V cell treatment is more effective because it saturates all the blood to wake up more your stem cells. Cord blood, that's good for hematopoietic stem cell regeneration, for angiogenesis if you need more red blood cells, white blood cells. It's good to immunomodulate autoimmune disorders. It's good for leukemia, blood cancers. Wharton's jelly is the ideal tissue from the umbilical cord. It's like a cushion for like degenerated joint diseases. You do not want to IV Wharton's jelly. It's pretty thick. You don't want to risk a clot or a thrombus, all right? Then we have bone marrow, which is the first FDA approved stem cell therapy in the US. Bone marrow derived stem cells for leukemia, blood cancer. Bone marrow is a poor source for orthopedics just because there's not a lot of mesenchymal cartilage, soft tissue forming stem cells, but it is excellent for immune disorders because that's where your white blood cells and red blood cells are produced. And then we have fat-derived stem cells called stromal vascular fraction. The problem is if you're over 30, the older you get, the less regenerative your fat stem cells are. So if you do fat stem cells, it works better if you're under 30, okay? So that's what's available on the market. Oh, and then there are what's called extracellular vesicle therapy, nanotherapy, called exosomes. At the end of the day, exosomes are released by the stem cells, and they carry messenger RNA to the damaged tissue, and exosomes have the instructions or the healing signals to tell the tissue to repair, okay? So I like to think of the stem cells like the post office. It's pretty big, but it's not gonna fit, like, it can't pass the blood-brain barrier. It's very large. So we just take trillions of exosomes, and the more, because they're only 50 nanometers, they could pass the blood-brain barrier. So it has more systemic effects than the whole stem cell, okay? This is some of the research that we're doing with the regenerative labs. Dr. Parita, orthopedic surgeon, he's part of this study. So the scanning electron microscope on the right, the dark image, that's what Wharton's jelly umbilical cord tissue looks under microscope. You see this collagenous strands, very similar type 2 collagenous fibers. The image on the left with the arrows, that's a torn cartilage in a knee. The cartilage becomes very stretched and torn, they become very thin. These are type 2 collagenous fibers. So the argument is when we inject the Wharton's jelly, because it's homologous tissue, that way it repairs. That's what the FDA wants. They want, it has to be homologous use. The structure and function of the tissue has to match the structure and function of the donor. No systemic effect. We're not going to IV Wharton's jelly. It's going to affect one joint. And minimally manipulated. You can't mix a drug. You could dilute it with sodium bicarbonate or saline, but no drugs added. And it has to be in its pure form, okay? So it's called 361 FDA guidelines, and that's what we're operating under. We just can't make any claims it does anything, okay? All right. Here's some example of some of our proof of concept, observational clinical studies. This is a patient with his L5-S1 disc, has stage 4 degeneration. In layman's terms, it's bone on bone. Normally, a patient with this would need titanium fusion. Instead, we injected the Wharton's jelly with several rounds of laser stimulation. You could see the after X-ray. You see how the spine opened up? So the disc base has been regenerated. I think it's because we strengthened the multifidus muscle, which is your posture muscles. And now the recurrent meningeal nerve that causes back pain, he has no back pain and no more sciatica, okay? There was a study done on a group of rats. They divided it into 2 groups. So let's say you guys are the rats, and there's 21 on this side of the room. You're the control, and 21 on this side. The 21 rats who had the control study, they had a sham laser. It was fake. It did nothing. The rats on this side, they had the real laser, okay? And the results of the study, they were able to regenerate chondrocytes in the rat's knees. So the laser somehow stimulated the rat's own stem cells to come out of the bone marrow and regenerate the cartilage tissue. So it makes sense if it happens in a rat, it can happen in a human. So we started doing our own trials. I just don't have, $10 million and 15 years of research to do it, right? So we monitor your progress through inflammation. So we'll scan your joints with the infrared thermography. People think red is hotter. No, white is hot. If you burn coals like in barbecue, it becomes hot, becomes white hot. Think of it that. So the image on the right is this gentleman had knee arthritis, inflammation in his legs, after the Wharton's jelly injection laser treatment. You see his legs are red. It's normal skin temperature, 98.6, and he has no knee pain, and he avoided the knee replacement. So we do use the 250 watt super pulse cold laser from Italy because it penetrates deeper and doesn't burn you because it's cold, and it's super pulse, so the photonic energy doesn't accumulate longer. All right. This is an 88-year-old patient with pretty much bone-on-bone, late-stage osteoarthritis of her lateral knee. She had knock knee. You can see that after X-ray, the increase of joint space after the Wharton's jelly injection and several rounds of our laser treatments. Okay, and she was scheduled for bilateral knee replacements. Could not go up and down the stairs. See, it doesn't matter how old you are. She was 88. The birth tissue derived stem cells, they're day zero old. They're programmed to repair. You just have to stimulate it with the laser so they keep repairing and growing. Okay. I like to think of stem cells, they're like firemen. They home in on the inflammation. So that's why we check the inflammation in your body, and that makes us decide where we're going to inject the firemen, the stem cells. Okay. This is an interesting study. So because of the second law of thermodynamics, if you put stem cells in a flask, they're going to go all over the place. Things get in disorder. Okay. But if you put a certain wavelength of laser through the flask, where are the stem cells attracted to? The light, right? All I could explain this phenomenon is if you put a plant on a windowsill, where the plant's going to go? They grow towards the sun, right? It's called tropism. They want that ATP energy. So we could manipulate the cells where to go with certain frequencies of laser, okay? There was a study where they IV'd some stem cells, and they lasered through the chest, and then they were able to increase ejection fraction, which is basically for heart failure when the blood's not pumping enough. Here's tropism right here, okay? So here's how exosomes work. Again, the stem cell is the big round circle upper right corner. The small vesicles are the small exosomes that deliver the healing mRNA signaling messages to the target tissue that's damaged. There are many athletes who have regenerative medicine that extend their careers. Even Jack Nicklaus, when he was 80, couldn't stand up. He flew to Germany, had stem cells from Dr. Alt. He came back, and now he's golfing and walking again. Okay? So there is really no joint, nerve, or soft tissue that the birth tissue products cannot regenerate. You're not going to be 10 years old, but we try to get back seniors and baby boomers back to tissues they love, pickleball, golf, whatever. Okay? George Bush, by the way, did not ban stem cells. He banned aborted embryonic stem cell research lines. Of course, we don't use aborted tissue. We use afterbirth tissue, just so you know. Okay? I had meetings with Dr. Peter Marks. He runs CBER, basically the FDA division who regulates stem cells. So I got all the guidelines to make sure it's compliant. Come by my booth. I'll give you, this is my best-selling book, 21st Century Pain Relief. And my new book is called Startech Stem Cell Signaling. If you want a free PDF digital copy, you're going to text my phone, I will email, and I will text you a free digital copy. If you want a physical copy, just come by the booth, and then we'll get you a physical copy, okay? Looks like I'm out of time, so any questions, come to the booth, or I'll be in the back. Thanks for listening, okay?